NHS, recovering from a 4-day Easter weekend, straight into a 4-day strike of junior doctors, 96 more hours of challenge. We don't seem close to the closing phase of the dispute where it all goes quiet and serious talks begin. For the doctors, their professional body, their union, the BMA, held a demonstration in Trafalgar Square this afternoon. I went down there to hear the doctors' view. Rain has just started falling. You're hearing the noise of the fountain at Trafalgar Square, not the rain. It's not that hard. Quite a few people gathering here. We're a little ahead of the formal start time of this, but junior doctors determined that their voice should be heard. Let us talk to a couple of them. Why don't you tell me what your banners say? What does your banner say?
Oh, so it's upside down. It says pay restoration for doctors. So we're all here to strike basically for pay restoration. Our pay's been eroded by about 26%.
And you've also got one saying striking for patient safety.
Yes.
You've got
the same, pay restoration for doctors,
I'm empty-handed.
So what would you normally be doing today? Tell me what you would be doing.
I'm an A&E reg, so I'd be working in a busy West London A&E.
Yeah, I also work in A&E. I'm a senior health officer.
Now, look, I want to talk to you about the 35%. Because a lot of people say, get real, guys, you're not going to get 35%. No one's getting 35%. And asking for 35% is undermining your case. Is there something in that?
So we're not asking for a pay rise. We're just asking for pay restoration. So we're asking for pay to go back to how it was. I know that 35% sounds like a lot, but...
I mean, so if one agrees with your maths, it's a big cut in real pay that you've had, the 35%.
Yeah.
But obviously, people go through a lot. The world changes over the decades, and picking an arbitrary point against which you benchmarked your salary may sound unreasonable to other people.
It's about the people that are leaving. Me, I've got a job in Australia. I'm leaving August the 1st. The salary is much, much better. The hours are less. We are losing very, very good doctors to other systems. It's, of course, about the pay restoration, but we need to retain staff in the NHS. Year on year, there is an exponential increase of doctors not going into training for financial reasons, because of patient safety, because of the moral injury we face. I wanted to stay and go into training in the UK. If we were paid a bit more and I was allowed to have flexible training hours, I would be in training.
I think for a lot of us here, we know that we're paid more than many people, and it might sound a little bit almost insulting to people who are on minimum wage.
Well, also very, very much better prospect. So we can compare your salary to a pret-a-manger barista, but their salary isn't going to go up as much as yours is over your career.
It's exactly as Josh has said. We are here because we are losing so many people. I haven't gone into training myself. I've waited 2 years. I might be waiting a third year. And it's because it's simply not an attractive prospect. You're being asked to sacrifice a huge amount of your life, your 20s and your 30s, to unforgiving rotas with zero flexibility. And you have to do something to make that an attractive prospect, or nobody does it.
Tell me, all three of you, I want you to now close your eyes and think of a number, okay? Below 35%, or at or below 35%, at which you would like a settlement, at which you would say that's fair.
I'm not going to answer that. No, I'm not going to answer that, because it's more than just a number. And this is the thing that people are preying on. They think that it's about selfishness or greed, and it's not about that. It's about everything that comes with it.
Just one more thing, our department every week is dangerously understaffed.
Yeah.
People waiting 10, 11, 12 hours in a waiting room because we don't have enough doctors. And the only way to get more doctors is to pay them more, unfortunately. So we're not here because we want to make a bit more cash.
3 junior doctors, in fact, down at Trafalgar Square, the rally there this afternoon. It's clear what the doctors think, and remember, their strike ballot had something like a 98% support level on a very substantial turnout when they voted on it. The government's position is pretty clear too. Here was the Health Secretary, Stephen Barclay, reiterating it today.
Well, I deeply regret these strikes, and in particular the timing, which has been timed deliberately coming straight after Easter. The fact that the BMA junior doctors have asked their members not to tell NHS managers whether they intended to go on strike or not, making contingency planning more difficult, and also their refusal to agree any national exemptions. And obviously that puts patients at greater risk.
Well, what do the public think right now? Kieran Pedley is Director of Politics at polling company Ipsos MORI.
So we've been tracking public support for various professions that have been on strike in the past year or so. And one of the things that we find is that NHS workers tend to be some of the most supported by the public. And our recent polling on the junior doctors' strikes specifically backs this up. So right now we find that 54% support the junior doctors that are going on strike, which is more than twice as much as the 26% that oppose. We've seen a slight increase. So at the beginning of the year, 47% supported the junior doctors going on strike. Now that's up to 54%. But I think what's more interesting is just the relative position of junior doctors compared to some other professions. So whilst they're not as supported as nurses and ambulance workers, around 6 in 10 tend to support those groups of workers going on strike. Junior doctors are more supported than other groups like teachers, railway workers, civil servants, university staff, almost all other professions. So certainly a group that enjoy wide public support at the moment.
Kieran Pedley of Ipsos MORI. Well, let's talk to Nick Hulme. He's the Chief Executive at the East Suffolk and North Essex NHS Foundation Trust. Nick, thanks for joining us. Just before we get on to today and how you've been coping, just where is this going to land? What figure are you talking about with your colleagues in terms of it's going to be between 0 and 35, I'm imagining, as to where settlement will eventually come when it inevitably does come?
Good evening. I think it's really difficult to talk about specific numbers, but I think the principles, wherever the number ends up, need to be very clear. First of all, we do need a quick solution. There are thousands of patients having their care disrupted. There's increased risk right across the system. So we need a quick solution. It needs to be equitable. It needs to be looking right across all of our staff that work in the NHS, perhaps wider in the public sector, to make sure that it is and feels fair. It also needs to feel right for the junior doctors. They need to feel as though they've been heard and that they've been listened to, and that there is an offer there that they can live with. But most of all, well, not most of all, but equally, it needs to be affordable, because whatever the government agree with the BMA, we need to make sure that additional money is made available from the Treasury to fund it. Because if it's left for trusts like ours to fund, that will have an impact on the services that we provide. So I think they're the principles. The number, in a sense, is less important than those principles.
Okay, fair enough. Right, how's today been at East Suffolk and North Essex?
So we've got two acute hospitals at Ipswich and Colchester. We were able to provide staff for all of our emergency services. So as the services, well, obviously been running overnight, but we started our planning meetings in detail at 5:30 this morning. We've been running every couple of hours to look for how our rotas are covered, who's coming to work, who's staying away, looking at any clinical risk across the whole of the site, and indeed in our community hospitals, and move staff around. What we have seen is probably slightly less activity coming through our emergency departments than we'd expect on the day after a 4-day bank holiday. I think the media have played a big part in that. It's certainly had a lot more media, or the strikes had more media presence, which I think has been really helpful over the weekend, reminding people to stay away from A&E unless there's a life-threatening or an urgent situation. So that certainly helped. We have had to cancel most of our elective work and most of our outpatients, obviously, to provide the staff with emergency care.
Have the consultants all been on holiday? There were some quite high numbers of consultant vacation figures going around. I don't know whether that has made it all much more difficult.
It certainly made it more challenging. 23% of our consultants had leave booked. Some have volunteered to come in and cancel their annual leave. We haven't required anybody to do that. But it's been a case of coxing and boxing with our clinical staff. But of course, it's not just the consultants. The nurses have stepped up. Our therapists have stepped up. Sort of managers and everybody stepped up with more admin support, more IT support on the wards, just to make sure we can safely provide that care to our patients.
Can you go out and hire locums to come in and fill gaps?
We can do that. We've tried to keep that to a minimum, because obviously a locum coming in just for one shift is quite difficult. They don't know the systems, the processes. Clearly we use locums quite a lot, so it is something we've been doing, but we're fishing in a relatively shallow pond with a lot of other trusts, so we haven't had great success in filling those posts with locum staff.
Yeah. I mean, obviously we're on day one. We've got another 3 to go, haven't we? And then who knows whether there'll be another 4 after the next 3. And I wonder what you're feeling, as the prospect of this dragging on looms. Well,
I suppose a couple of thoughts. Firstly, that yes, it is only day one, and people will. There's a certain, not quite excitement, that would be the wrong word to use, but a sort of adrenaline, really, I suppose, in terms of the planning and getting everybody seen and getting around the wards. We don't know what's going to happen over the next few days, or indeed any ongoing industrial action. suppose the other thing that's important to remember, that all those patients who've been cancelled today, whether outpatients or inpatients or day case patients for elective care, will have to be rebooked. That will inevitably mean other people with less severe clinical priority moving further down the waiting list. So the impact of but the 4-day strike that we've got at the moment will go on for weeks and months in terms of ongoing disruption. And finally, it's a massive distraction to the running of health services. So the amount of time that managers and clinicians and others have spent planning and now delivering the plan is a huge distraction to the work we want to be doing, which is to shorten waiting times.
Nick Hulme from East Suffolk North Essex Foundation Trust, thanks so much for talking to us. It's 17 minutes past 5 now. Let's have a look at some other headlines.